you're a Family Island resident with no confirmed cases of the illness, the prospect of those communities being exempted from a 24-hour curfew is promising. Here's Health Minister, the Honorable Dr. Dwayne Sands.
The signals that we're getting from the Family Islands are positive. Those signals are being assessed on a daily basis, and the recommendations coming from our technical teams are being considered, and a determination will be made as to when to relax the lockdowns, the restriction of movement in these communities. If this is sustained over the next few days, I believe that we will be able to pull the trigger on some of these decisions. But the signals need to be sustained over a period of time in order to assure that the trajectory continues. We have been fortunate. The decisions made were done in a timely fashion, and thus far it appears to be having, at least in those communities, and even in New Providence and Grand Bahama, some positive impact. So it shouldn't be too much longer.
Well, it was during Thursday's press conference that officials confirmed an additional case as well as an additional death, now the 9th.
Out of these 9 persons who died had comorbidities or underlying illnesses. 4 out of the 9, or 44.4%, of these patients were obese. 3 out of the 9, or 33%, of the cases suffered from high blood pressure. 2 out of the 9, or 22%, experienced asthma. And 1 out of 9, or 11%, of the cases suffered from either sleep apnea, high lipids in the blood, kidney failure, and diabetes. There are 5 males and 4 females. 1 of the deceased is from Bimini, 5 from New Providence, and 2 from Grand Bahama. My fellow Bahamians, it's a fact that as of April 16th, our COVID-19 confirmed deaths are 6.4 times more likely to have comorbidities or underlying medical conditions.
According to Dr. Sands, at last report, 892 contacts had been identified through contact tracing. Now, while the Bahamas instituted RT-PCR testing as the so-called gold standard, and this considering it doesn't give false negatives, it is exploring the introduction of rapid testing.
It is confirmed that although rapid tests give faster results at cheaper prices, they are often inaccurate. Since all of the many types of these tests have not yet been internationally validated, the Ministry of Health is only now exploring this method and is not using it as a confirmatory test at this time. Once our validation process is completed, and if these tests are found to correlate with our gold standard RT-PCR method, wider screening for COVID-19 at the community level will commence. There are 10,000 rapid test kits in country.